New Jersey is on guard tonight over the outbreak of swine flu that's come at least as close as New York City, with more than 24 cases confirmed there so far. U.S. health officials yesterday declared a public health emergency over the outbreak, with 41 confirmed cases in the United States at this hour, including the New York cases. In Mexico, where this strain is believed to have originated, 149 deaths are being attributed to it. Here in the Garden State, officials are already taking action. Now, Adrian Sapino is in our Newark bureau with the latest. Adrian?
Jim, here in New Jersey, there are no reported cases. But today, the state health commissioner said that the outbreak could land here because of the Garden State's diverse population and its proximity to New York City. And today, customs agents at Newark Liberty International Airport stepped up their screening of people coming from high-risk countries like Mexico, where the strain is thought to have originated. Leaflets warning about the disease were being handed out this afternoon, and customs agents at Newark Liberty are monitoring those entering the country more closely for swine flu. Additional cases of infected students in New York were confirmed today, and World Health Organization officials say the disease is spreading globally.
Currently, Customs and Border Protection is conducting passive screening on passengers that are arriving from higher risk flights. We're looking for passengers that may be exhibiting flu-like symptoms, and we would make those referrals to the Centers for Disease Control.
This unique strain of a flu that normally affects pigs originated in Mexico, where the strain is being blamed for nearly 150 deaths. Many of those sickened from the flu in 5 U.S. states, New York, Texas, Kansas, Ohio, and California, had recently traveled to Mexico. Some returning from Mexico today wore masks.
I got it at home with my in-laws in Mexico. Everybody's wearing masks.
I bought my own. I mean, when I was driving from Cuernavaca to Mexico City, the army was there, and they gave me some masks.
Officials say in the United States, people seem to be recovering more quickly than in Mexico. Symptoms include fever, cough, chills, and fatigue. The rash of cases has also spread to Canada, and probable infections have been reported from New Zealand to Spain.
I would be a little concerned, yeah. I think you have to take precautions, make sure you don't get ill.
What are you doing?
What am I doing? I'm taking airborne. I'm getting plenty of rest. That we're drinking lots of water.
Countries around the globe have increased vigilance amid concerns about a pandemic. The European Union has advised against non-essential travel to Mexico and the United States. And U.S. government officials warned that the problem could get worse here, possibly resulting in deaths.
We are closely monitoring the emerging cases of swine flu in the United States. And this is obviously a cause for concern and requires a heightened state of alert.
We continue to approach this investigation and our control efforts aggressively. That's because you don't know going into an outbreak what it will look like in the end.
New Jersey officials fear the disease will enter the state.
We took the initiative to warehouse Tamiflu in 2006 in both North and South Jersey. So we have stockpiles that if we were in a position that we wanted to move, the state has its ability to move outside of what allocation we'd get from the federal government. I think we're prepared.
A travel warning remains in effect for Americans traveling to Mexico. And the last time that swine flu was getting this much attention was in 1976 at New Jersey's Fort Dix. 230 soldiers were sickened, 1 died, but the disease did not make it off the base. Jim?
All right, Adrian, thank you for that report. And joining us now is Dr. George DiFerdinando, an expert on public health. He's a former New Jersey acting Public Health Preparedness at UMDNJ. Dr. Ferdinando, thanks for coming in.
Thanks for having me.
Well, how bad does it look to you, Doc?
Well, at the beginning of an epidemic, it's very unusual to see different types of responses in 2 different countries. So just like Dr. Besser of the CDC said, we don't know what this epidemic is going to look like in the end.
We see President Obama talking about it, so he's weighed in. We see our governor talking about it, he's weighed in. When would this become the pandemic that people talk about, and what would be the danger therein?
Well, we've got a novel virus here that people aren't used to responding to. Seasonal viruses, seasonal influenza. You see it often year after year, and people develop immunity to it. This one, the general population has no immunity to it, so a pandemic would be spread throughout the entire community with no real background immunity.
In Mexico, there have been 149 reported deaths. Here, there have been none at this hour reported. What is the difference? Why are people dying in Mexico and not here?
That's not clear at all. That's one of the big discrepancies that is unusual here. You normally see similar types of syndromes with the same pathogen, and we'll have to find out exactly what's going on, why the cases in the United States, while still, of course, serious to the people that have them, haven't resulted in the same type of mortality that you see in Mexico.
We heard in Adrian's piece a flight attendant saying she was taking airborne. We see people in that video there wearing masks in the street. We see travelers talking about masks. How can somebody protect themselves? And do these other types of options, masks, airborne, maybe inoculations, or how does somebody protect themselves?
Yeah, I think you've hit on it here. Now's the time for the general public to review really the basic protections that we all really know, but we have to remind ourselves of. Thorough washing of our hands. If you're taking care of a relative who has what you think might be influenza, you try not to have face-to-face care with them. You try to stay out of range of their coughing. And people who get what might be influenza really have to do their part in terms of covering their mouth and not going out as much, staying in the home to avoid spreading it to other people.
Dr. DiFerdinando, some of our viewers might remember you, I do, from the anthrax attacks that occurred in New Jersey in '01. You were acting health commissioner then. You led the charge to try to protect people. Did that inform us of anything? Did we learn anything there that we can apply today?
I think we did. One of the things we learned is that the New Jersey population will keep on working even under a lot of pressure. The postal workers and other people who were exposed at that time kept going to their jobs and kept working. I think that's heartening for us. The other thing we found is that it took longer to get the information, turn the information around from lab results and recommendations. We're really seeing a shortened information cycle from the CDC and from the World Health Organization, and that's very beneficial. The information will get to the public much quicker.
All right, Dr. DiFerdinando, thanks a lot for coming in. We do appreciate it.
Thanks for having me.
All right.